Cancers are on the rise, especially in adults under the age of 45 with no history of risk factors like tobacco and alcohol use. So what's causing the spike in cases? Joining me today to help answer that question and provide the signs to look out for is surgical oncologist at the University of Mississippi Medical Center, Dr. Gina Jefferson. Thanks so much for joining us today.
Thanks for having me.
So you guys are noticing a rise primarily in younger adults. Are you noticing this more in patients from Mississippi or across the board nationwide?
Across the board, nationwide, since the early 2000s, there's been a significant increase in the number of young individuals diagnosed with oropharyngeal squamous cell carcinoma, that is throat cancer, and that's because of the human papillomavirus that we are calling nationally an epidemic. So in epidemic proportions, the rates of throat cancer have increased while the cancers traditionally related to tobacco, such as voice box or laryngeal cancer and oral cavity or mouth cancer, have decreased with the rate of decrease in tobacco use.
Oh, wow, that's so interesting. So HPV is contributing to more cases nationwide.
That is correct. And this virus can actually be prevented by vaccinating children beginning at the age of 9 for HPV. It can prevent not only the development of oropharyngeal or throat cancer, but other HPV related cancers, such as cervical cancer, which most people are familiar with, also anal genital cancer and other cancers related to the human papillomavirus.
Wow, that's so interesting. So HPV is contributing to more cases nationwide.
That's correct. So in 2015, the incidence of human papillomavirus related throat cancer actually surpassed the incidence of newly diagnosed cervical cancers as a result of the virus. So indeed, the human papillomavirus is very important in causing throat cancers nationwide.
Wow, that's interesting. And so what are some of the signs that people need to watch out for? Where does this cancer usually appear in patients?
That is a great question. Like several cancers, such as cervical cancer, there is no screening test for the development of human papillomavirus associated throat cancer. So some of the signs to look for are one-sided or unilateral ear pain that is constant. That usually represents an abnormal finding in an adult because the nerve that gives sensation to the throat on the right versus left side is the same nerve. It has branches to the ear canal or the eardrum, and so you can have a constant ear pain as a result. Other signs that might be present are a lump in the neck. Oftentimes patients will seek medical guidance from their primary doctor regarding a neck mass. The primary provider often gives antibiotics, but the mass persists, and that is abnormal in an adult. Other signs might be a change in the voice. It might sound a little muffled. Someone might have difficulty swallowing. They might have occasion to cough up blood. They might have pain with swallowing, and they might actually notice an ulcer or abnormal lesion inside of the mouth or the throat.
All right, interesting findings there and important things to look out for, Doctor. We thank you so much for all of your insight today, and hopefully this will help a lot of people with early detection of the cancer.
Thank you so much for having me.